We really want you to know that babies cry, and it's okay, and we're not doing anything uncomfortable or hard, and it's really easy. And so we don't know what's going to happen with this little baby today, and we know what normally happens, so feel free to get comfortable so you can see. We know that, hi. This, I think, will just help you see that it's easy to do, and you can be flexible, and it's really important for these little ones to have this help.
I'm going to throw out one caveat because I get asked this time and time and time again. When I tell families to bring their young child to the dentist, they say, well, I don't understand. They're not going to sit in a dental chair and open their mouth. And then I say, it's just like when you bring them to the pediatrician. They don't open their mouth for me, or they don't, put their ear up. I say, you hold the child here, and we get the ears looked at, and we get the mouth looked at, and the dentist who's trained in seeing infants will be able to do the same thing, and suddenly they go, oh, okay, I get it.
We will typically do this in our hygiene bay. So I have 3 different chairs. They're all sharing the same room. If I have other children positioned in different chairs, I kind of give them a heads up. Baby's coming in, they're going to sit on their mommy's lap, they might cry. We're not hurting them, but we have to count their teeth, we're going to brush them, and it's going to be okay. The important part is to make sure we are sitting knee to knee with everybody's feet flat on the ground. Most of the time, they're not real cooperative.
So what we do is we have the baby straddle the mom, legs on either side, and we have the mom lock her elbows around the baby's legs. That way the baby, when the baby lays back, the elbows keep the baby's legs in.
Cool.
Now, one of the very first, easiest tools for you to use is the infant toothbrush. I can tell so much by just having that brush in there for just a couple of minutes. What I'm going to be looking for is plaque, the amount of plaque, any inflammation when I get that toothbrush in there. And I start by Steve, our gentleman that was just outside, our old B-Rep, stage 1 toothbrush. Fantastic for those under age 1 and just shortly above. Oh, what is it? Now, sometimes ease access is a little tricky. It's great until they get their cuspids in. There's a little finger room. We just stick and wrinkle. What's it? Baby sweet. You're very soft, sing-songy. They're going to kind of start taking their cues from us. The more upset they get, the less upset we get. We start really drawing out our syllables. Oh my goodness, what is doing? Well, all the while we're in here, not only are we looking for plaque, we're going to be looking for sequence. Make sure eruption sequence is good. Health of gum tissue. We're going to look at all the vestibules. We're going to look for eruption cysts. We're looking for cervical demineralization. Don't be afraid to use a little 2x2, maybe your air, just to dry something off. Oh my goodness! So we've brushed. Everything is looking great on Eli. Flossers. I always have one on the tray. I need to demonstrate how easy this is for parents. Usually it's an instant recovery. There are some, though, that get out to the reception area and out to the car and they're still sobbing. But that's okay.
Drama queen.
It's okay. Know that we're not hurting.
Already been a drama queen.
Now, if you were a high-risk baby, and in part when we begin this need to need, we already have that information after we've counseled with the parents, asked them certain questions. How's brushing going at home? Oh, it's great. he does a great job. How is brushing really going? Are you hands-on in your child's mouth? And if that is an issue, then that's a perfect opportunity for us to talk about positioning, getting parents to do me-to-me's like this, wrapping him in a towel after bedtime. Sometimes that helps keep arms and everything down. Sitting with them on the floor and kind of putting them up and keeping your legs up on them, doing one of these, okay? Or sitting on the potty seat, having standing facing away from you and tilting them back that way. That's a good way too. So that's the perfect opportunity. Now, if I have tons of plaque in here and mommy has already said, you know, yeah, we get a lot of juice. Well, how much juice do you get? Well, a couple, 4 ounces a day. Really? Well, how are they getting it? Are they cruising with it? Or are they sitting at the table? And that kind of cues you as to what you need to talk about. Okay, the recommendation is no more than 4 ounces a day. Don't water it down. Present it with meals. If they're cruising around with a sippy cup, it needs to be water in that sippy cup, not the juice all day long. And if you're in there and you see that we've got inflammation as well as lots of plaque, then you can say, okay, let me show you how to get in there. Lift up that front lip. This is usually the trickiest part. Make sure you're getting in there, lifting up that lip. Get that toothbrush right up there. They're not going to be hurt by you getting in. Let's see. Fluoride applications. I did not bring the fluoride with us today. We buy the fluoride varnish in the clinic pack. So it's just a little tear open. We actually squirt it on the backs of our gloves. We kind of mix it around. And then at the very last part, after doctors already looked, because it can hinder your view of things, you get in there and you're going to rub it all over. I smooth it out with my fingertips just so it doesn't look so chunky and bumpy. And then they're done. They get drinks of water afterwards if they need to, if they want anything to drink.